Hi Ross, this is Yaz from MediRoots. I hope you're well. Thank you so much for joining us. Could you please introduce yourself and tell us a bit about your chosen specialty?
Absolutely. So my name is Ross McAllister. I'm an SD4 in trauma and orthopaedics. So I've been a registrar for about 18 months, just over 18 months now. My training started at Nottingham University, where I did standard five-year course, and during that time was when I started to get an idea that I wanted to do surgery. I wasn't entirely sure what subspecialty necessarily, but surgery was the kind of thing that I was thinking towards. So then when I came to be doing my foundation job applications, I kind of had that in mind for tracks that I wanted to pick. So I picked a track in Manchester that had two different surgical jobs, one in orthopaedics and one in general surgery. So I had a reasonable experience during the foundation years about what it might be like, and I carried on enjoying surgery as an F1 and as an F2, and at that point decided that I wanted to try and get onto the core surgical training pathway. So I went through the application process for that and got a CST job in Merseyside. So went across from Manchester into Liverpool and did 2 years of CST, which had 12 months of orthopaedics, 6 months of plastics and 6 months of neurosurgery. During that time, when I started, I still didn't know for sure that it was orthopaedics I wanted to do. I knew it was something that I really enjoyed, but I also liked the idea of plastic surgery at that time as well. So I wanted to make sure I got some experience during those 2 years. So I did the 6 months of plastics, and essentially after that, about halfway through, decided that I was pretty firmly set on doing orthopaedics. So I then sort of started to tailor myself towards what the application requirements of the ST3 stage were, doing the kind of things that were going to get me more points, I guess, and more likely to get a job. And so I went through the application system for that. My experience was pretty unique in terms of getting onto the specialty training, because it was just during the COVID period. So when I started the application, we was expecting it to all be normal, but during the process they cancelled all the interviews and the jobs were allocated based only on the portfolio. So I managed to avoid doing a face-to-face interview, but got onto the training programme again in Merseyside, because I wanted to try and stay around the region, as I'd started to get to know it quite well. And as I say, so now I'm 18 months into the specialty training programme, and as things stand, we'll have about four and a half years left to go.
So thank you for sharing your experience. So Ross, could you please tell us how does it feel to be a registrar in trauma and orthopaedics? What does it involve? What do you do day to day, like on a daily basis?
Yeah, so first and foremost, I love being an orthopaedic registrar. It's really good fun. It's really varied, and our days are different depending on what we're doing. So our job allocations depend on what area of the body we do. So we operate on arms, legs, spines, pelvises, and you'll be doing subspecialty jobs. So at the moment I'm doing a job that's predominantly hip and knee surgery, but previously I've been doing shoulder and elbow, or foot and ankle. So depending on what subspecialty you are, depends on what your day looks like. But alongside the elective side of things, which is the people we see in clinic and people we do elective surgeries on, we have the trauma, which makes up the other half. And the trauma, generally speaking, can be anything, so broken bones across the body, and we'll manage them either as an inpatient when they're in the hospital, taking them to theatre, particularly things like hip fractures, which tends to be some of the more common things, or we manage them without an operation and via the fracture clinic, where we can have quite hectic clinics, seeing lots and lots of patients in a morning or an afternoon, and making decisions about the management. So the day-to-day job is really varied. It's a mixture between clinic-based stuff and surgery, where we get to do a lot of things even from quite a junior stage in the training program. We'll be able to start building our surgical skills in things like hip fractures to start with, and ankle fractures, and building that up as you go through the training program. So it's a busy job. It can be quite hectic at times, but it's really enjoyable. And personally, I get a lot out of it and really enjoy the day-to-day work.
Thank you again. So, what do you think are the benefits of this specialty in terms of work-life balance, job opportunities, flexibility? Would you say you've got a good work-life balance? Do you think you will have a job after you complete your training? And how flexible do you think you can be as an orthopedic consultant?
I think orthopaedics is a good specialty for flexibility as a consultant, particularly because when you become a consultant, you develop your subspecialty interest and you can hone in on one particular area of the body. So as I say, things like foot and ankle or hip and knee, and you can become a subspecialist in that area, and that appeals to someone like me who likes to know quite a lot about a particular thing. So rather than being really generalist, you can focus on one particular area, but it has the benefits of being able to stay general for the trauma side. So you don't sort of lose your skills at the end of the training program when you become super subspecialist, as you might do in some other specialties that only focus on one thing all the time. In orthopaedics, has the benefit of having a quite a narrow elective practice, but then being able to manage the general trauma in a much more broader sense. So I think that's particularly good. I think in terms of the work-life balance, it varies. I think as a registrar, the work-life balance it can be quite intense at times, particularly when you're working in the more busy hospitals, at the trauma centres. Shifts are very busy, and you can be run off your feet at times. I think when you become a consultant, the work-life balance is one of the better ones when it comes to surgery. So in some surgical specialties, there's a lot more emergency operations that go on overnight, and consultants get called in during the night to operate fairly regularly. Orthopaedics doesn't tend to be one of those specialties that does a lot of nighttime or out of hours operating. So with the exception of a handful of real emergencies, particularly at district general hospitals, consultants can have quite a good work-life balance when it comes to on-call commitments and on-call requirements. So I think surgical specialties do tend to be a little bit further along the spectrum in the work-life side of things, but orthopaedics is certainly one of the better ones when it comes to thinking about that.
Perfect. So what would you say the drawbacks are?
So I think sitting here as a registrar, the drawbacks of orthopaedics are that there's no doubt it requires a reasonable amount of dedication, because you need to have met all the requirements as you go through to get onto the different training programs, to start with core surgical training and then higher surgical training. They're both competitive applications, and you have to have put a reasonable amount of forethought into it and tailored your application to the requirements that they're looking for. So that certainly requires a level of dedication that inevitably means spending time outside of the normal hours, completing presentations and audits and teaching sessions and things which, if you're really interested in orthopaedics, tends to be much more manageable because of the aim that you're trying to achieve, which is to get onto the training program. But there's no doubt it does take up some time and it requires some dedication. The on-calls, as I say, can be quite busy, and it can be quite stressful because you're dealing with some significant injuries at times and having to make decisions about what the best management is. And when you're making a lot of decisions in a short period of time, there's no doubt that can be quite tough to deal with at times, and you have to remind yourself about keeping your mind stable when you're at work, and then when you're out of work, when you have time to sort of de-stress and decompress from those things. I think that's an important thing, and that's something that I focus on to try and manage that side of things. So it's busy and it's hectic, and sometimes it can feel a little bit overwhelming, but with some strategies that you can develop to manage that kind of thing, I think it's certainly not the drawbacks aren't enough to put me personally off the career.
Oh, that's great. So what do you think are the requirements to this role in terms of personality traits? Do you think trauma and orthopedics suits everybody, or is it not for everyone?
I think there's no doubt you have to enjoy the work that you're doing is the first thing to say. I think if you don't enjoy what you're doing on a day-to-day basis, you'll struggle, I think. But having said that, you don't have to enjoy everything, and I think there is a sort of preconception that you have to absolutely love everything about your job to get by, and particularly for the more competitive specialties, but I don't think that's necessarily the case. But I think you do have to get a good enjoyment out of it, and with that comes the dedication that you need to have to be able to do the things that are required to get onto the training program. So as I say, I think personal advice on what the things to do to try and get there are to really focus on what the requirements for each stage are, what the requirements to get onto the core surgical training program are, what kind of things you have to have on your portfolio, what things are they looking for in the interview, and the same things exactly stands for the SD3 interviews, to think about what are the things that they want you to score points for, what are they looking for during the interview. And I think if you're interested in doing orthopaedics, then that's the thing to do, to look at what they're looking for and tailor yourself and your application towards that. I think there's no doubt you have to be hard-working, and you have to put in that time and effort. And the things that I enjoy out of orthopaedics is that everything happens relatively quickly, in the sense that you get given a problem, for instance a fracture, you have to make a decision about what the management is, and you make a change to that patient's course by doing an operation which you see results from immediately when you look at x-rays and seeing that you've lined things up nicely, or you fixed it in the right way, and that's something that can give me personally satisfaction at that sort of on that time frame, rather than other specialties where things are a little bit more drawn out and changes the patient's management is over a longer term. So I think people that enjoy being hands-on, being practical, particularly hard-working, and enjoy seeing those sort of short-term improvements are people that would be particularly tailored towards orthopaedics. But I think some of the misconceptions are about the personality that you have to go into orthopaedics, that you have to be quite a bit of a brute, and that's certainly something that is changing, and I think that's only for the better. And I think when I look at the registrar sort of cohort, it's a much more diverse population than it maybe was in previous times, and I think that's only something that's beneficial to the specialty.
That's fantastic. Ross, do you know how, I know you've already touched on this topic, but do you know how people can apply for trauma and orthopaedics?
Yeah, so I think, as I say, everyone will have to go through the foundation program, and then to get onto orthopaedics, the majority go through the core surgical training program, which you can apply for after your F2 year, but you don't have to apply for it straight away. You can take years out as an F3 or an F4 even, or more, and apply for CST following that. In more recent times, there is now also run-through options for orthopaedics, which have fewer, and there's only a handful of them, I think, across the country, but they allow you to get straight onto the orthopaedic training program from the equivalent of CT1, they call it ST1. So you still do the same number of years, but the advantage of it is that you don't then have to reapply at the end of CT2 to get onto the ST3 program. So there's at least one, but usually two applications that go through. And in terms of the things that score your points, generally speaking, the themes always are the same, although there are some tweaks every couple of years on exactly how the points are scored. But things that happen at an international or national basis always score more points than things that are local or regional, and that's the same for things like presentations or teaching projects, the kind of things that they always look for. And then accompanying that, qualifications are always useful. Anyone who's got higher degrees tends to score more points. But then there's things that you can do a little bit more easily, like doing things like postgraduate certificates, and things like medical education or medical leadership tend to score points as well. So, as I said, my main advice is to have a look early at what the points are allocated for, and then make a decision about what can be achievable, because some things you're not going to be able to do. You're not going to be able to get a PhD. I certainly didn't have a PhD, but I looked and saw that if I got a presentation at a national level rather than the regional one I had before, then that was going to get me almost as many points. So it was a much more achievable thing. So I spent time working on that. So deciding how many points you've got already, where you can make improvements, is the main thing to do early on. And then have a think about what kind of things they're looking for in the interview. So that's person specification, looking for the kind of requirements that they're wanting, and what the skills that they're trying to elicit from the candidates, so that you can try and display it when you come to the interview.
That's perfect. So just a tricky one. If you were a medical student or a junior doctor, do you think you would have taken the same career path, or would you have chosen a different specialty?
I think if I was a medical student, I would certainly still carry on the same path in terms of where I've got to go through the experience of trying out different surgical specialties to decide which one I liked, and then sort of picking orthopaedics at the end of it. It seemed to be a really natural pathway and a really natural decision. I think if there was one thing I would change, it would be to try and get a little bit more experience out of that conveyor belt of training, because I was always concerned that I might not get onto the next stage and wanted to give myself as many opportunities as possible, so applied at the first available opportunity for each step, and I was fortunate enough to get a job each time, which was obviously what I wanted when I applied. But looking back, I would have really benefited from taking a year out to do something else, to go to another country to get some more experience of being a doctor but not being on that conveyor belt of training when you're working on a portfolio all the time and you've got that at the forefront of your mind. So I think in my path, I think that would be the only thing that I would change, would be to take some time out, and I recommend that to anyone who was thinking about it. If it was something that you were thinking about, I would really recommend it, because I know many people that have done it and they've all benefited in their own way from having done it, and it's the only thing that I would change at this stage, I think.
Thanks for your honesty. Any additional and final tips for our medical students and junior doctors, foundation trainees, or anyone who is planning to change their specialty? Anything for them?
I think the first thing to do is to gain experiences from as many things and as many people as you possibly can, because everyone will have had their own experience. As I say, I've talked about mine, but it will be different to many other orthopaedic registrars, and everyone has their own collective set of experiences. So sounding out as many as possible is always useful, I think. Likewise, getting experience about those application processes from different people, as they'll each have different things to say, and will be able to tell you what kind of things they found helpful, what kind of things that they wouldn't spend their time using or doing, and you can create your own set of things that you think will be useful to you. There's a lot of resources out there that are particularly helpful. As I say, I know Yaz has got his MediRoots Guide to Medical Careers book, which I've had a flick through and looks really useful for compiling all of those things that I mentioned about the application process and person specifications into one book, so that you can flick through that and see what they're looking for. And it's got QR codes that you can zap on your phone to get up-to-date information if anything's changed, as it occasionally does. But I think using resources that people have found useful, particularly, is something that allows you to be as prepared as you possibly can to make decisions, and then once you've made the decision about what you want to do, putting yourself in the best position to be able to achieve what you're looking to do.
Thank you so much for your time, Ross.
No problem.
I'm sure everyone is going to really appreciate your time, and they're going to take notes from whatever you have mentioned, and thanks again for sharing your experience.
You're very welcome.
Thank you.